Hi, everyone. My name is Dan Toner. I'm the health insurance broker for Secret Box. And we are now speaking mid-September to talk about the open enrollment. The Secret Box plans have a fall, like in October for dental and November renewal from the medical insurance. So this is open enrollment. This is sort of the time of year where we can make changes. You can join the plan if you've waived previously. So this is a memo that I'm showing on my screen. It's going to be forwarded to you, so just take a peek at it. We are offering two different health plans from Aetna for medical. It's important to know that both have national provider access, New York, Pennsylvania, New Jersey, any state. You don't need referrals to see doctors. And the plans have both in and out of network coverage. We offer a voluntary employee paid plan from Delta Dental and a vision plan from United Healthcare. This is a little copy about just to show what benefits are being offered. This is the existing plan that is there today, the Aetna POS 1500 plan. We are offering a brand new plan with lower cost, meaning your paychecks deductions, because for some of you that don't go to the doctor a lot, this is sort of maybe a catastrophic plan, some call it, but I'm going to go over some of the features in a second. At the bottom, renewal plan. This is the same plan from last year, and the new plan is little couple of bullet points that I'm going to go over right now. The lower costing option, this new plan called the point of service 9100, when you go to your primary care doctor, you pay nothing. The deductible is waived. That's what DW stands for. If you go to an urgent care center, not emergency room, but those urgent care centers, you pay nothing. And if you get generic drugs, you pay nothing. Also, both plans have your annual well visit, your checkup. Your annual checkup is free. So basically, you have four benefits under this plan to the right where you owe nothing. Primary care visits, like your sick visits, urgent care, generic drugs, and well visits. That'll be your lowest costing out of your paycheck. We're going to go over that in a second, the costs. This is the existing plan, the 1500. And for those of you that are looking for better coverage, like you only want to pay a copay when you go to a specialist, or you only want to pay a copay when you go to the emergency room, all of those other things are subject to a $9,000 deductible and then are paid at 100% under the low-cost plan. Under the richer plan, there's a $1,500 deductible and then 100% coverage. So there's a couple of reasons you would upgrade, pay more money out of your paycheck to go from sort of this base catastrophic plan to the 1500. One is you wanted to pay a copay to the specialist or the emergency room. Two is you wanted to pay a prescription copay for name brand drugs. Those are subject to the deductible on the plan to the right. And you also wanted for hospital, surgery, and MRIs, you have 100% coverage after an only $1,500 deductible. So that's part of the lure, if you will, is why people would upgrade and pay more. If you don't think you're going to go to the doctor that much, some people will buy more of the catastrophic plans. If you think you're going to frequent the doctor and possibly have hospital and surgery, you may pay more money out of your paycheck and be on the 1500. So I hope that makes sense out of the two plans. On the Aetna website, once you get your ID number, go ahead and register. You can see your EOBs, print your replacement card, order a new card, see your coverages. This is how you look up doctors. The network is called the point of service. There's a little instructions on how to look up the doctors. The dental plan is not changing from Delta Dental. On the second page here, I have a copy of the benefits. These are the benefits that are paid at 100%. Your preventative and diagnostic, like checkups, cleanings, exams. Fillings is like a basic service. You could see some of the other stuff that's covered, perio and oral surgery. 80% means Delta pays 80% of the bill, you owe 20%. And major services are your crowns and inlays. They're covered at 50%. Delta pays 50, you pay 50. How a dental plan works is you get a maximum of $2,000 a year. So whatever Delta is paying out, 100% for this, excuse me, 80% for that, 50% for the crowns. They're going to pay up until they hit 2,000 if you're using their PPO network, or they're going to pay 1,500 if you're using their Premier network. So everybody covered. If you have a spouse or dependent, everyone gets this benefit. If you're a single, then you're either getting the 1,500 or 2,000. On January 1, you get a fresh maximum for that upcoming year. On vision, we're using United Healthcare. It is a national plan. If you have a medical condition, like let's say glaucoma, that'll be covered under medical, like the Aetna. But if you're looking for routine coverage, reimbursement for lenses, frames, and contacts, you need to purchase a vision plan. And we did that through United. Excuse me. There is a $10 copay to get your eyes checked every year. If you're wearing glasses or have contacts, you'll have a $25 copay. For those wearing glasses, you'll get a $130 reimbursement for frames, and then usually a pretty significant discount. You have out of network, but I encourage most of you, if you're buying vision, to go to the UHC network, go onto the My UHC website and look up. They have a lot of vision providers. So even though there's an out of network benefit, most of you will be in network and achieve these benefits. Okay, and here's a copy of the benefit summary, to explain it a little bit better. How do you make your elections and enroll? So this is a plan election sheet. You're going to write your name at the top. This is that base plan, right? That 9,100, where you could see deductible waived for the urgent care, primary care, etc. And this is the existing plan that's there today. On the second page, you will see your contributions per week. If you're an employee, you'll pay $36 to be under the core and the 9,100 plan, or $76 to be under the 1,500 plan. So obviously there's your savings on a weekly basis if you want to buy the lower costing option. And if you're going to add a spouse, if you want to add children, and if you want to add spouse and children, these are the 4 different ways. If you do not want to participate, you'll check off this box. Dental, these are the copy of the reminder of the benefits. These are your weekly costs to participate. Delta does it a little different. If you're adding 1 or more, or 2 or more dependents, those are your costs per paycheck. And vision, 4 different rates: you, spouse, children, and family. So hope that makes sense. There's some resources for Aetna and some of the programs they have, teledoc and gym reimbursements and health coaching. This is the phone number for Delta Dental and the website, as well as United Healthcare. And this is my team, FFP. That's our benefit office. Amanda, myself, this is me, Dan Toner, and Leslie is our support that helps us enroll. So any questions, feel free to let us know. Open enrollment, we're going to probably get it going till, I'd like to get it going till the 6th of October. It's okay if the 9th or 10th, but at some point on the week of the 9th through the 13th, I'd like to notify Delta and UHC and also Aetna if there's anybody new. Otherwise, everyone's on the existing plan will renew as is. But we do want your election since we're adding a new plan to the medical. All right, that's it. Have a great day.